was back on for the Q&A session. That is brilliant. Thank you very much. Okay, Simon, over to you.
Thank you, Kim, and hello, everybody. My name is Simon Rowland. I am the Sustainability Manager at NHS London Procurement Partnership. And as Kim mentioned, I'm going to do sort of the first half of this presentation, which is a little bit about the landscape of walking aids across London and England in the NHS, and then Joe's going to go into a walking aid reuse scheme that he has set up for UCLH. So why walking aids and why walking aid reuse? Walking aids are one of the top 20 medical devices for carbon intensity in use across the NHS. 87% less carbon is in a refurbished walking aid than a new one, and that also includes a 100-kilometre return journey. They've been identified as quite low-hanging fruit, given the low risk of infection and common reuse schemes across the NHS. There's a target of 40% reuse rate set out in the Delivering a Net Zero National Health Service paper from 2020. Note that that's reuse, not return rate. Now, I don't know whether that's going to change, but in order to improve the reuse rate to 40%, the return rate is going to need to be even higher, because we know that not every walking aid that comes back in will be able to be put straight back into reuse. We're also going to need to address things like behaviour change to ensure there's consistent availability and approach across the whole of the NHS to help change the culture and increase return rate. A large amount of that is around patients, because at the moment I know a lot of patients will still kind of not know or not think to return it. It will go into a loft, it will go into a roof, and then either get cleared out at some point in the tip, or never get back to never get shared again. So it kind of becomes embodied and wasted carbon. There's a huge cost saving potential, with £15 million spent on walking aids each year across the NHS. Savings can be huge per trust as well. So some of the reporting it can be up to £46,000 a year in savings. Now this is kind of seen through NHS Futures and their walking aid case studies. So the cost savings can be huge, but essentially the idea is that by reusing them, you are procuring less walking aids, which will hopefully be a saving across your trust. So we have worked with Greener NHS in London on a walking aid reuse project. The aim of this was to increase walking aid reuse provision across London. So when we started in London, there were 12 walking aid reuse schemes across about 30 to 40 hospitals, I think. But obviously not all of them dealt with walking aids. So we had 12 trusts with across 20 out of 23 that distributed walking aids that had reuse schemes. To run through this project, we did extensive research, including surveys, interviews, desk-based research, and meetings with suppliers and industry, but also with community equipment services, with local councils, to kind of get an understanding of the landscape of walking aids and how they're distributed across London. It is quite complex in London. I'm sure you're experiencing similar in your areas, but because London's quite compact geographically, you've got lots and lots of people involved in walking aid and walking aid distribution, that are literally vans crossing each other with different authorities involved, crossing each other in the road, because we've got such a compact, tight geography, but also a lot of trusts involved and lots of councils involved in doing that. So we developed an options paper setting out the scale of the landscape, the scale of the reuse, and some options for trusts in London. We were able to distribute some funding for trusts across London to start their journey on walking aid reuse, and now we've got at least 16 trusts with reuse schemes, with at least 2 more coming online in the coming months. So we've upped that from 23 from those 12 trusts to 16. So that means that we've got about just over 75% of the trusts in London should have walking aid reuse schemes in the next few months, which is an increase of about 25% over the last sort of year to 18 months. So I mentioned the landscape. I don't know whether you guys are familiar with it. but essentially it's incredibly complex the way walking aids are procured and prescribed. They're prescribed by and procured by several local health and social care bodies. So often there's a joint effort through local authorities and trusts in things such as community equipment services. We also then move that into procurement. So you've got trust procurement and NHS supply chain. You've got local authority procurement contracts with their members and third-party suppliers. And you've got a therapies department who have this different selections of where they can procure their walking aids from. Some of these are third-party suppliers, which provide their own recycling provision, but these are not always universal. They may only recycle their own equipment, or they may offer to pick up service only for larger, more valuable items, meaning that walking aids are often still left in people's attics or garages. NHS Supply Chain have now included a recycling lot in their latest walking aid contract, which aims to include all walking aids to be recycled used, but I don't know if any of you have taken advantage of that recycling lot. As we mentioned, it can also cut through many different departments in hospital building. So we've got therapies and other clinical departments in AHPs. We have procurement, we've got community departments, we've got infection control involved as well in these sort of schemes. So it's bringing a lot of stakeholders together. Many trusts have set up their own recycling schemes internally or in partnership with third parties. And Joe will be talking a little bit more about his in the second half of this talk. So from our project, we're at about the 6-month stage for a few of the trusts now, and so we've got a bit of feedback from the reports. What we've seen is that the third-party schemes, jumping on those seems like a good idea initially, but sometimes it may not always provide the maximum cost and carbon savings. You're having to arrange for a third party to collect your walking aids at a time that suits them from your trust. When sometimes doing it throughout your doing it internally and as your own trust allows you to take more control over that. The advantages with a third party is that you're bringing everything together with an organisation that knows exactly what they're doing with this. Internal schemes are a good internal project to promote and market sustainability. So what I mean by this is that it's quite often a good flagship project because it's really visible. Usually a walking aid collection will be driven by people on the hospital floor. So a lot of staff will know what's going on and begin to feel like they're involved in that sustainability journey. It can also be about formalising and scaling up existing ad hoc behaviour. We hear lots about trusts and departments that already accept walking aids that are returned informally, clean them and then put them back into circulation. Sometimes it's just about scaling this up. And we've also seen some trusts with reuse rates as high as 80%. So, I mean, we can be talking significant reuse here. So, as AHPs, where can you come in? You're often going to be the face of this sort of scheme. You will be distributing the walking aids and telling patients about the return process and their expectations. It's also a way to connect procurement and sustainability teams. You're going to kind of you can be the hub and the nexus of that and really get involved in like a Green Champions scheme. You're able to champion the scheme as well. We've heard a lot about engaged and passionate therapists who have driven this. You're the driving and the delivery force of a scheme that will be better for the environment and reduce carbon emissions. So it's great to celebrate that and find people in your trusts and therapy teams who are also passionate about that. So we're just coming to the end of my slides now, and then I'm going to hand over to Joe if he is here.
I am indeed. Thank you, Simon.
Perfect.
Hi, everyone.
Cheers, Joe.
I'm Joe Burton. I'm the Sustainability Project Lead at University College London Hospitals. I'm not going to go through slides. I'm going to go through a bit of an SOP, which might sound boring, but hopefully isn't, that we put together for our own internal walking aid scheme. And for a bit of context on that, we have 2 drop-off sites at our hospitals. We have one in ED where patients can drop them off, although that is behind a desk, as opposed to just being out in the open. And we have one at the walk-through to one of our other buildings that's quite a high turnover, which staff put them in. In terms of how ours is organised, we are having our walking aids refreshed by therapy assistants within the trust, and that is organised on a bit of a rota. I know that some other trusts have organised this, have used, say, portering capacity, or have used, say, healthcare assistant capacity. Internally at UCLH, the agreement from the therapies team was they wanted someone with some knowledge of these conditions that they're used for, to have some therapies knowledge to kind of refurbish them, which is fair enough and is how we've gone together. So what I'm going to do is I'm going to walk through the SOP that we put together, which I hope is useful and will answer quite a lot of the questions some of you may have, and show you some of our data as well. And I'm happy to share this afterwards if it is useful to you. Some of it's a bit specific to the trust, but it should broadly be applicable to everybody. So I'll make it a little bit bigger, and I'm not going to just read off it, don't worry. So starting off with some of the rationale behind this, some of which Simon has already touched upon. As we said, crutches, frames, walking sticks, they're all in the top 20 of medical devices within the NHS and have a pretty high carbon footprint due to the high footprint associated with aluminium manufacture. There's some other environmental issues that sit with aluminium manufacture. And if anyone wants to Google an Australian aluminium mine in the background, you'll see what I mean. There's huge holes in the ground, red mud leaching. But aluminium is this great material that can essentially be indefinitely recycled. So in that sense, being able to reuse these and actually do our bit to minimize the amount of aluminium that is in turn mined and turned into a walking aid is a really great thing. I think the first thing to identify for anybody who's looking to set up a walking aid scheme is there are a number of groups that you want to get hold of and to be a part of in order for this to be a success. One group in particular that you need to start with is your Trust IPC team. This doesn't have to be a particularly big blocker. Our team are happy with them being wiped with the Clinell wipe, and your organisation should be too. The chances of a walking aid carrying an infection is an incredibly low risk. I would say they're no higher a risk item as, say, a blood pressure cuff, which is wiped between uses or should be wiped between uses. The other stakeholder to really loop in with early is your procurement team. If you are doing an internal trust scheme, I think just to kind of preface that what I'm talking about is less about a sort of where you have other contracts, those that provide walking aids, if you are running this yourself, although most of what I'm saying is probably still going to apply. If you don't contact your procurement team, you'll encounter the issue that we encountered when we first started this, which is we're collecting all these walking aids, and I'm getting some replies from the therapists at work here saying we're overrun with walking aids. And the reason for that is that no one, by that no one being me, had said we actually need to reduce the order level of those that come in. So it doesn't have to be masses, but if you don't actually reduce the number that you are purchasing in sort of real terms, you are making no difference. If you reuse 10 walking aids, we're buying 100 before and you're still buying 100, unless your patient demand has gone up, you're actually not making any real differences. So loop in with them pretty early. And depending on how your site is being run, you may also need to engage with your estates and facilities team. We have our crutches collected by the therapy team, or they just take them upstairs because of where ours are. Depending on where you may choose to put any box, I know some trusts have got porters that move them. You may need to engage with your estates and facilities team. So back to the roles of the stakeholders in this kind of scheme. For the professionals that are issuing them, it's relatively simple. It's just to inform patients that you can return these, and patients that want to will do so. And interestingly, I was chatting to someone recently who set up a walking aid scheme and did some research on actually what motivates people to return these. And for those who were older patients, the motivation to return these was around saving money for the NHS. For those younger patients that issued these, it was actually the sustainability side of things that motivated them more. So we promote both of those things to patients when they're going to be collecting a walking aid and hopefully returning it to us. For those who are processing a refurbished aid, we follow a bit of a checklist, and this checklist has been adapted from the checklist that is on the Walking Aids How-To Guide, which I'm sure some of you will have seen on Future NHS, and I'll go through that in a bit more detail. And we use a Microsoft form to capture the data about our patients. IPC, I've already touched on. Our waste contractors, this is another, if you have a separate waste contractor worth picking into, you will get some walking aids back that are so damaged that they cannot be reprocessed. So if you can get these through a multi-metal recycling stream, if you have that in your organisation, it's absolutely worth doing so. I've touched on these two already. Patients, simply return them. So what's the process actually? How does this work in practice? So we have essentially 2 recycling bins that we have repurposed for this, and we've put the stickers on the front that says you can return them here. So patient comes, drops off their walking aid, then move for cleaning and assessment. So clean with the Clinell, clean the whole shaft, all the handles. What do? We assess the extension, test all the buttons, have a look visibly. Is there any wear, damage, rush, stress, cracks? Twist it, apply some weight. Is the metalwork bent or bowed? Have a look at the grips. Are they deformed or worn? Are they missing anything? Are the pads off? Are they tight enough? Have a look at the ferrules. Those that are aware, ferrules, the rubber feet on the bottom. Replace them if you need to. Now, if any of those checks aren't passed, we record that in our form, which I'll come to in just a minute, and they go to metal recycling. For those that aren't suitable for reuse, we've bought some of you might know the green tape, the Clinell tape that says I'm clean. Not a sticker anymore, it's tape. We just wrap it round, record the results, and then we put that back to our stock. Before we got things sorted with our procurement team, they were being kept locally, and then we tried to have our procurement team look at the local stores and look at the major stores, and it just didn't work. So now what we have is, because the way our organisation works, there's sort of a path threshold level for ordering. Clinicians know to use the aids that have been returned first, and then go to wider stock cupboards. The procurement team checks the wider stock cupboards, and everything kind of flows through as it should. And the latest data I've had is showing that we are reducing the number that we're ordering. For us, notes on frames, we are a really space-constrained organisation, and we're central London, so actually people returning frames just don't get many back anyway, because carrying one on the tube is probably not applicable. You and your organisation may do, and considering that they are the biggest thing, if you can refurbish a frame, then fantastic. We don't really get any back, and even if we did, we try not to take them because we just don't have the space to do so. The rest of this is all sort of UCLH specific, as is this. In terms of record management, I'll go on to the MS form soon, but legal considerations in incident management, some of you may already know this. Walking aids aren't now marked as single patient use. NHS resolution has confirmed in very, very clear terms that under the public liability section of the liabilities to third party scheme, if there was any legal action to be brought against a damaged walking aid, indemnity is provided there. So there is no risk to trust from a legal perspective of doing this. We also do have it built in to our incident reporting system, our Datix, that people could do an incident if a walking aid fails that has been refurbished. As of yet, we've been going for about a year, 2 years now, a year and a half, actually, year and a half. We've had no incidents yet about an equipment failure. In terms of training, we had one of our Band 8 and Band 7 therapists. They just sort of went round to some therapy assistants and just showed them how to do it. So in that sense, that was all of the training that was required. There are some very limited costs with the way that at least we run our scheme, but they're not major. Any cleaning materials, Clinells, they're going to be things you have anyway. Any replacement parts like ferrules, you may be a small cost to budgets there. Any containers to drop them in. We thought originally we needed a mask to wear them to clean them. We don't, so you can ignore PPE and the tape that you can buy. It's on supply chain. It's like £2.20 for a meter for like 20 odd meters. It's not expensive at all. There are, of course, a couple of risks to a scheme like this, but really they're minimal and can be mitigated pretty easily. Not being assessed before being reissued to a patient. We've got a pretty thorough plan that we show to staff and ensure they know how to do that to mitigate that. The result isn't added to our MS forms to track our data. It's not really the end of the world if that doesn't happen, although it's useful to know how many we're recording, but ultimately we'll see how many we might have reduced purchasing by looking at our procurement data. It's another reason why it's really good to get into your procurement team, because you'll know if you ask them to pull the data. We get them to pull our data quarterly, how many walking aids we haven't purchased that we might have done previously. Patients don't return them, well, you get back what you get back. And there's any fails causing injury to patients, as I've said, we haven't had this happen yet. An NHS solution would cover you if that was the case. So this checklist that people use when they're assessing them, we don't actually print this out, it just for sort of reference. You may want to have a couple on the wall if this is kind of an approach that you follow. So I've gone through all of that stuff already, but that's it just sort of laid out. What I'll show now is just how we track our data. Now, different people will do this in different ways. As you can see, it does not take very long for this to happen, 2 minutes per form. We just ask for what date did it come back in, what was the location, what was the product type. As you can see, we've only had crutches back so far. We've not had anything else back. Pair or single, we asked that because we only reach them as pairs at the moment. We did explore a charitable route for some of the singles, but unfortunately it fell through. And then would the single have passed? But that's not really a relevant question anymore. Questions about manufacturers and product reference, in the very odd chance that there is a product recall on this, which I don't think is very likely. But if there was, we can have a sense of A, how many have we given out, and B, I believe we buy pretty much all of ours from one supplier. We get a sense of those that come back that aren't strictly quote unquote our walking aids, but then probably a lot of our walking aids end up at different organizations anyway. And then the sort of real stuff that matters, did we replace the ferrules? On the majority of the walking aids you'll see, which is 86% we do. Does it pass our checklist? Again, as you'll see, the majority that come back, 92%, do. So that suggests that almost all of the walking aids you get back, pretty much 9 in 10, will be suitable for issue. Why have they failed? The majority have failed because they can't take the stress. And then the outcome of them, the majority, go back to our stock, a few for recycling. I'm not quite sure what other is. I probably should know. In essence, that is how we as an organisation set up our walking aid team. So I suppose for me, if you take away anything from this, I think link in with the key teams and know your key stakeholders. It really helps to have someone who is in that role pushing it forward. So I work very closely with one of our lead therapists in ED. They took it forwards. They had the ability to sort of say to people, you need to do this. We want you to do this, because actually refurbishing a walking aid, if you're a therapist, is not necessarily a particularly fun task. So it's making sure that people see, we're doing this for resources, we're doing this for the environment, we're doing this for the bottom line, and actually having someone in a department that has the ability to push those things forward does it in a way that I probably couldn't do. Linking with your procurement team, because that's essential to making this work, and any blockers that you face, an organisation has probably already faced anyway. So I think I'm going to stop there, and we've got a bit of time for questions. But I'm happy to share that form, and I'll probably send that to you, Kim, the Word document, and all attendees can have a copy if they so wish. Thank you.
Thank you very much.